It's a pleasure to introduce Dr. Bella Specktor, which will be our first speaker, presenting improving robustness of large structure segmentation using partial annotation. Bella is a lecturer at the Medical Imaging Sciences Department at Haifa University. She completed her PhD at the Hebrew University, and prior to that she worked on medical imaging algorithms at Philips, and she is also the founder and organizer of the MLMI at Haifa machine learning meetups. So welcome and happy.
Thank you very much, Ayelet. And this work is part of my PhD thesis at the Hebrew University. Okay, so a little bit about the motivation. So automatic segmentation, volumetric segmentation can be very useful for many applications, and specifically for fetal MRI, segmentation of the fetal body. This can be, for example, used for weight estimation. And of course, if we're dealing with automatic segmentation, we're dealing with deep learning, and we need a lot of annotated cases. Now, when we are doing these annotations of 3D images, this can take more than an hour for each case. Okay, so think about your domain and how many cases can you do at this time, but in medical images it takes a lot of time. And so the idea in this work was to use partial annotations just to reduce the time that it takes to do one scan. And the idea is that maybe in this way we will have a more robust model, because we will be able to annotate more scan with the same annotation cost. Okay, so how do we do our annotation? So assume that each vertical line here is actually a plane, a slice, okay, perpendicular to this 2D image. And now what we want to do, we want to annotate consecutive slices. And the reason we want to do this, because this is the natural way that people annotate 3D images. They want to see, they go back and forth between the slices just to see the 3D structure. And this is why we want to do these consecutive slices. And actually prior works usually don't do that. And the one who do, they don't compare partial annotations and full annotations with the same annotation cost. So this is the goal of our work. Okay, so how we do the annotations? So first the user clicks the uppermost and the lowermost slice of the structure of interest. And then the system automatically selects, you can see here the vertical yellow line. This is actually the slice that was selected, and the user needs to perform the annotations around this plane. So how do we train this? Of course, we don't have annotations for the whole structure, so we need to train it a little bit differently. So first, we choose only the blocks where we do have some annotation. This is the blocks here in yellow. And we train this thing with a selective batch dice loss. What does it mean? It's very similar to the regular batch dice loss, just the dice loss for the whole mini batch. But now, instead of taking all the voxels into account, we are taking only the annotated voxels. And how can we know which one? So for example, one way to implement it is just add a binary mask of the locations of the annotated slices. Okay, and of course, also the voxels outside of the structure of interest, they are, we know that they are not, that we don't need to segment them. So again, they are also considered annotated slices. And we use a large batch size of 8. Okay, so because we have very few annotated data sets, we use a two-step optimization process. So first, we take our learning rate and just reduce it on plateau, which is a regular procedure. Then we take the best network and we perform fine-tuning with learning rate restarts. And you will soon see why it can be interesting and how it is differentiating the partial annotations and the full annotations. Okay, so in terms of the design of the experiments, We performed segmentation for fetal body for the trophy and fiesta sequences. For the trophy sequence, we had in distribution data, which means large fetuses with gestational age between 28 and 39. This is the data that we used for the training set, and also here in the test set we had large fetuses. For the fiesta body, we again had the in distribution data of large fetuses, but we also had small fetuses. So we also had there out of distribution data. Okay, and in all our experiments, we compare only 6 training fully annotated cases to 30 partially annotated cases with 20% of annotated slices, which means that they should be pretty much comparable in terms of annotation time. Okay, and of course, because we are dealing with so little number of cases, we performed 4 different randomizations, and the results that you can see here soon, they are the average of those randomizations. Okay, so here are the results for the trophy body segmentation. You can see here that first the fine-tuning was helpful both for the full and the partial annotation, specifically on these data. When comparing the full versus partial annotations, which is the green and the blue lines, bars here, you can see that the average performance is quite the same, but the standard deviation for the partial annotations is smaller. Okay, this is the phenomena that we see here. In the left, we see the DICE score. In the right, we see the ASSD, pretty much the same behavior. Now, when we are looking on a different sequence, on the Fiesta body sequence, so when we are looking on in-distribution data, we see, again, very similar results. The fine-tuning was helpful for both the full and the partial annotations. When comparing between them, the average performance again was pretty much the same. However, the standard deviation for the partial annotations, you can see it here. I don't know if you cannot see the pointer, but in any case, the standard deviation, we can see that it's lower for the partial annotations. Now, the interesting thing comes when we are looking on the out of distribution data here. So now you can see that that when comparing the full and partial annotations, you can see that we have differences also in average performance, with partial annotations having a DICE score of 0.9 compared to full annotations with a DICE score of 0.84 even. Okay, so this is a big difference. And also an interesting thing to note here is that now when we are continuing the training, we are doing our training longer with the 2-step optimization process, you can see now that suddenly for the full annotations, we see a deterioration in the results. Okay, this is what you can see there in the italic, which may indicate a potential overfitting. So now we checked if those results are indeed significant. And you can see here that they are. So you can see here we performed repeated measurements to ANOVA. And you can see that the results are significant for the annotation strategy and the interaction between the annotation strategy and optimization. If we're looking on the images themselves, just to get a feeling of what happened there, so you can see here in column 2, if we're looking on the top row, for example, so you can see there a segmentation which is not perfect, but it's pretty much okay. Okay, and then when we are continuing with the training and performing fine-tuning, suddenly we see that the fetal body here is completely missed. Okay, so actually the longer training was not beneficial for us, and actually here probably there was a phenomena of overfitting. On the other hand, we didn't see it in partial annotations, and actually maybe I will come back to the table here. You can see that the fine-tuning was actually helpful for the partial annotations. Okay, so just to conclude, So we presented a new method of partial annotations, and we saw that it was more robust compared to full annotations, both in terms of the standard deviation and in terms of average performance on out-of-distribution data. And we saw that specifically for longer training, we saw that partial annotations benefited for longer training for both in-distribution data and out-of-distribution data. And the full annotation setting, which is usually performed, we saw that for out-of-distribution data, we actually had a deterioration in performance. Okay, thank you very much.